Hi, everyone, and welcome back to the Gut Health Dialogues. Today's episode is a really special one because we're diving into the complex and often misunderstood world of histamine intolerance and how it connects to both gut health and chronic skin conditions. I know a lot of you listening are dealing with food sensitivities, skin flare ups, and feeling like your body is reacting to everything. And this conversation is going to unpack what might really be going on beneath the surface. And I'm excited and honored to introduce today's guest because not only is she incredibly knowledgeable, but she's also someone who's been through this journey herself. She brings a powerful mix of clinical expertise and personal insight that makes her work so impactful. Jennifer Fugo is a clinical nutritionist empowering adults failed by conventional medicine to beat chronic skin and unending gut challenges through her root cause approach. She has experience working with clients all over the world through her virtual clinical practice to overcome chronic skin issues such as eczema, psoriasis, rosacea, dandruff, and hives. Jennifer also founded her own line of skincare and supplements available at quellshop.com, specifically for people struggling with these chronic skin issues. She holds a master's degree in human nutrition from the University of Bridgeport and is a licensed dietitian nutritionist and certified nutrition specialist. Jennifer is also the host of Healthy Skin Show podcast with over 1.3 million downloads. Welcome, Jennifer.
Thank you for having me.
So you didn't start out in this world as a practitioner. You were actually a patient, right? So can you tell us about your story and how you got into this?
Yeah, I will say one thing that I think people really appreciate, that I can really empathize with where they're at, because when I started, and actually it was during grad school, I developed a form of eczema on my hands called dyshidrotic eczema. I did not have any histamine intolerance issues, but just the eczema journey alone, which was extremely frustrating. You don't realize how many things that you need your hands for. Like, simple things become unattainable and quality of life gets smaller and less colorful. There's less options, and you just feel like shirking away from life entirely. And so that was really what drew me into this space. And originally, I would see a lot of clients that were just like primarily gut focused. But then I started to get clients where every single one of them had some type of chronic skin condition. It just seemed like they wanted to, like, oh, but I've got issues. I want to focus on that. And so it was a journey to really learn so much about how skin is impacted within the functional medicine paradigm. It's different than just gut issues. It's a longer, more complex journey. And specifically around histamine intolerance, really thinking about it in a way that I never learned about it. Like, the way that I was taught about histamine issues is not really how I practice, because I had to start thinking outside of the box in order to help people get lasting results so that they didn't need to stay on their antihistamines or even like Xolair, for example. That's how I got into this.
That's so much to unpack right there because I think probably the listeners are thinking, okay, are we talking about skin? Are we talking about histamine? Are we talking about the gut? We're talking about all of it because
All of it.
it's really
Yeah.
hard to separate these issues, isn't it?
It is. It's very difficult because they are so interconnected. And I think one of the biggest mistakes that I have seen clients consistently make is that they are looking for the one thing. They're like, what's the one thing I can do that's going to make all this go away? And while I would love to be like, oh, okay, it's this or it's that, or try this supplement or take this out of your diet. The problem is that histamine intolerance, once it gets to a place where it's now showing up and manifesting on the skin. So first of all, I should put out there that eczema specifically, and this is one of the biggest points of confusion, is that most people assume that if you have eczema, you have a histamine intolerance problem, and that is completely wrong. It's actually less so that you have a histamine intolerance if you have eczema. So it's more common that it's not a histamine intolerance issue than it would be. Histamine intolerance issues for sure look like chronic hives, urticaria, and even the autoimmune type, or they will tell you, oh, we don't know why you have urticaria, but you just have it. It can be triggered by pressure to the skin, exposure to the sun, heat changes, that kind of thing. Dermatographia. So if you draw on the skin, and that's what it is, it's literally skin drawing. So you could scrape your skin and it'll welt up in that exact pattern. Angioedema, where there's swelling, those are pretty significant histamine intolerance issues, more so than it's just impacting your digestive system. And it's not quite to the point where we would say you have mast cell activation syndrome or MCAS. That's a more significant, more serious, complex problem. And then mastocytosis would be beyond that. In those two instances, I kind of feel like you might do better with a physician, like an MD or a DO, as opposed to trying to sort it out yourself. Because a lot of times you need medications at that point, that like mast cell stabilizing medications. But when it comes to histamine intolerance, so there are areas that can be impacted, like you mentioned, the gut, but also a lot of people don't realize that it's impacted by what's happening within liver detox as well. So there's a lot of different areas that we want to start to look at and hone in on. And oftentimes it's not just one thing that's going wrong, because sometimes people will have, for example, a particular infection, or they could have a really messed up dysbiotic gut microbiome, for example. And there's different things that can actually drive histamine tolerance within the GI tract. Actually, this was aired already on YouTube, so I'm not saying anything that hasn't been aired yet. But on my podcast, I interviewed Dr. Mariana Castells. She's a mastocytosis expert, I think at the women's, it's in Boston. She's at a hospital. They have a whole mastocytosis center. And what she's interestingly shared on the show was that the amount of histamine produced in the body when somebody actually has a real true histamine intolerance issue is like 10,000 times more histamine than what you get from food. And yet we fixate on food and we're like, let me cut everything out and that'll make it go away. And then you don't get any better. And you're like, now what? And it's because the amount of histamine that we're getting from food, it's not that histamine is bad. We need it. It helps us stay awake. But we also have to put it into context. If it's not just the food, if there's other things, then we need to start looking at the histamine bucket, the other triggers causing not only histamine release, but also producing histamine within the body itself.
Yes. So I like that you said the bucket because that's how we like to think of it, right? It's not that it's bad. It's not. It's a natural part. So histamine is a natural part of your body. It serves a function. It's in foods. It's produced by the immune system. But when our bucket overflows, we get too much. That's when we have issues. I think histamine intolerance is still such a misunderstood term. And I notice a lot of people who have heard about it and may even suspect they have it, they still aren't totally sure what it means or how it's different from an allergy or a sensitivity. So I usually break it down like this. Histamine itself isn't bad. It's actually a helpful chemical in your body that your body makes naturally. It plays a role in digestion, immune response, brain function, and inflammation, but it's supposed to stay in balance. With histamine intolerance, the problem is that you end up with too much histamine building up in the body, either because you're producing too much, like the faucet is just like on full blast, you're just overproducing, or because you're not breaking it down well. So maybe the drain is plugged and it's just building up, or both. And so it's not that the histamine is being produced inappropriately like it is during an allergic reaction. It's just not getting cleared fast enough. So it's like you're the walking histamine tank and you're just full of it. So that's different from a true food allergy, which involves the immune system and an IgE response. And in that case, your body sees something that's actually harmless, like peanut or shrimp, as a dangerous invader. Your immune cells release IgE antibodies, which trigger mast cells to dump out histamine and other chemicals. That's what causes allergic symptoms, like acutely, like hives, swelling, or anaphylaxis. It's sudden, dramatic, and typically reproducible when you're exposed to that agent. So histamine intolerance is different. It's more chronic. It's more your bucket is just keeps filling up. And that can be from different causes. It can be from foods, it can be from gut dysbiosis, environmental exposures, hormones, stress, and your body just can't clear it efficiently. So it builds up over time, it spills over. And that's why people often describe feeling like they are just reacting to everything because you're just in a constant state of overload. And that can be caused from not being able to degrade it, right? Either in our gut or in our cells, or overproducing it, right? And so the way I think of it is there's histamine intolerance. I think about not being able to degrade it more. And then mast cell activation where there's overproduction. And then you mentioned mastocytosis. So is that how you think of it? Can you clarify that a little
Yeah,
bit?
absolutely. I love that question, actually. So thank you for asking, because it's like, I'm just a curious person. So I'm like, let's talk about this.
And it's so complex. I have to categorize it in my mind
Yeah.
somehow because everything's so circular. It can get out of control.
And it can be really overwhelming. So if someone is listening to this and they're like, oh my gosh, this is so much bigger of a puzzle than I even realized, I feel you. I'm a visual learner. So that's one of the reasons, like in my episodes on the Healthy Skin Show, where I talk about histamine intolerance, or specifically, I actually call it histamine overload. I've made all these graphics because that's how my brain works. And I feel like that's helpful for people who do find this confusing. And a lot of people do. And I'm not saying I know everything. I certainly don't. I learn things every single day, which I love. So I think of it more, yes, we have the enzymes that break histamine down. So there's an enzyme within the GI tract called diamine oxidase, or DAO. You can obviously buy supplements of DAO as a supplemental replacement. There's that. And then within the cells, we have the HMNT enzyme that breaks down histamine within the cells. But what's produced and what's available kind of histamine wise within the GI tract, the only thing that's breaking that down is DAO. Now, I don't know what your experience has been, but most of my clients who have these issues find the DAO supplements to be completely not helpful. And so I started to think about that because I'm always curious, like, why isn't something working? It's great when like you go on all these like naturopathic and functional medicine websites and they're like, oh, take this. And I'm like, yeah, but that doesn't work. Like, why doesn't it work? I want to know. I'm not just going to take it at face value. And so what I realized was that it's not just the mast cells that are the problem within the body. You can actually be a literal walking histamine production factory and not even realize it. So I started to ask this question about DAO. Well, why does DAO not work? Because all these functional doctors at the time, so this was back in, let's say, 2017, 2018, we're still like, oh, we should test for a genetic SNP of the DAO enzyme. And I'm like, but why? Just supplement. I don't know. I don't like to waste people's money, right? Like, let's go the simplest route. And testing for a DAO SNP is expensive. So I tested this out and a lot of people didn't respond. They noticed no improvement whatsoever and didn't feel any better. So I'm thinking to myself, maybe, is it possible that there's so much histamine that even the supplemental DAO isn't actually helpful? Because that could be
Yes.
possible, right? If it exceeds the threshold, even with supplemental DAO, the answer is not, let's just throw in more DAO, right? I see that could be a solution, but to me, I want to know, well, then what's causing that? And that was where I started to look at organisms that either could destabilize mast cells, thus causing these mast cells that have, I think of them as like little histamine warehouses, like they dump their histamine, right? Like an Amazon warehouse, and all the packages spill out all over the floor. At the same time, there are organisms that produce histamine. And that's a bigger problem. That's something we can't account for. And it's oftentimes what's totally ignored.
Yeah, I love that you brought up the two different enzymes because that's something we talk about a lot with our clients too. And I think it really helps explain why people have such different symptom patterns. So, just to build on what you said, histamine is broke down in two places in the body. In the gut, we rely on an enzyme called DAO, deamine oxidase, to help break down histamine from foods or from the gut lining itself. And that's the enzyme most people hear about when they talk about histamine intolerance. DAO is what helps you handle the histamine in foods like in bone broth, leftovers, fermented food, wine, spinach. Inside your cells, though, it's a different story. And that's where HMNT, which is histamine N methyltransferase, comes in. This enzyme breaks down histamine that's already circulating in the tissues like the brain, the lungs, the skin. So when HNMT isn't working well, we might see more of those internal symptoms like anxiety, brain fog, insomnia, sinus congestion, rashes, or even asthma-like symptoms. And HNMT also requires good methylation to function. So if you are someone who has MTHFR or methylation issues, we may need to support that pathway with things like methylated B12 or methylfolate, magnesium, or SAMe. So those are some other supplements that we can use to support that natural pathway. And we're always careful with dosing depending on the person's sensitivity. So in our practice, our approach is layered. We never just focus on one thing. We're looking at the whole picture. Is HNMT compromised due to poor methylation? We might need to build that up first. Are mast cells overactive and dumping too much histamine into the system? In that case, we look at calming them down with things like vitamin C, quercetin, or stinging nettle. Though for those, and this is where I see a lot of people not doing this often, is we need a therapeutic dose. The label dose on most of those products just isn't enough to make a dent when someone's histamine bucket is already really overflowing, like you said, with these tremendous amounts of histamine. It takes more than just a sprinkle to calm the fire. And then we look at, are the dietary triggers making it worse? We help people identify the highest offenders without putting them on an overly restrictive diet, which can just add to the anxiety and fear. And when all of that is in place, meaning when we've supported the pathways and calmed the system down, then we often do see the DAO enzyme work and just as a supportive component where it can be incredibly helpful. So yeah, when there's just so much of a histamine load that, and you just add in the enzyme and you don't do anything else to support this complex issue, it's a drop in the bucket. You don't see it work. But when we use it as a tool, as part of the larger supportive process, we do see clients that do really well using the enzymes. It can help with occasional exposures. It can help expand the diet a bit once we've addressed those other diets first. Otherwise, it is like pouring water on a wildfire without turning off the gas line.
I'm sure you find this, that in conventional medicine, it is ignored to look at what organisms could be causing this sort of histamine response. There are some organisms that drive up our more allergic side of the immune system that will elevate, for example, your eosinophils. They'll elevate your total IgE, which most people would go, oh, that's an allergy marker. No, there are organisms crawling around and squirming around in your body that will also do that same exact thing because they play on that side of the immune system. And that was where I started to really get curious about this whole microbiome component. And yes, then we have obviously allergies in our environment. Another factor, I don't know, a lot of your listeners might not realize this, is if you have certain allergies to, for example, ragweed. What most people don't realize is they'll go, oh, I have a ragweed allergy, like a significant one that if they walk out during ragweed allergy season, they need like a Zyrtec or they're not in good shape, right? It's a rough day. They're taking liver detox supplements, except the liver detox supplement contains milk thistle, for example. Milk thistle is in the ragweed family.
Or artichoke too, right?
I don't know about artichoke, but stevia is also in the ragweed family. So dandelion root,
Dandelion, yeah, not
dandelion,
artichoke.
and milk thistle are both in the ragweed family. So if you have a ragweed allergy, those can be causing you to actually feel worse. There's that. Plus, you can have oral allergy syndrome, which I know they renamed it, but basically, if you eat cherries and your mouth feels all funny, and you're like, oh, I feel like my lips are starting to swell a little bit, that can be because you have, oh goodness, that's the stone fruit. I think that's
It's a
birch, a birch
cross
allergy.
reaction, yeah,
Exactly.
with
It's a
something,
cross
yeah,
reaction.
environmental.
So we have those factors. We have mold exposure, right? Because mold can also do some of this. Fungal overgrowth. So there can be a lot of things that can contribute to this. Even estrogen. If you have estrogen dominance, that can make your cells way more sensitive to whatever histamine is produced in your body. And thus, because the cells are more sensitive to it, you feel worse. So even your hormones can cause an issue. So it's not to say that somebody has all of these things. And I don't want anyone to go, oh my gosh, I have everything. I am a mess. Like, how would you even start with this? But it's crucial to really get clear on what exactly is going on, because then, as I'm sure you do for your clients, you can create an action plan that helps unwind this mess in a way that is efficient. If you have a tree of options, I think of those buckets, and you fill up one bucket and it feeds the other buckets, so that everything that you do is sequentially more effective. Instead of starting at the bottom and having to fill each rung, how do we efficiently get from top to bottom in a way that actually is helpful?
Yeah, absolutely. I talk about this all the time because they'll ask, like someone will take a gut healing supplement. I mean, they'll do all the right things, right? They could be taking all the right supplements. They could be taking the good brand of probiotic like the good brand of gut healing supplements, plenty of glutamine, all this stuff, and they'll wonder why they're still not better. And it's because you have to do the right things that are targeted to what you actually have going on, which could cause a lot of similar symptoms from different causes, in the right order. Because if you're just throwing a gut healing supplement, say, but you have a raging case of candida, you have a lot of inflammation that's continuing to be driven, and the glutamine can't even help your gut lining to heal when that inflammation is still there. So it's really what you're describing. I love that visual. It's like, take it one step at a time. Only when we clear the overgrowth can the gut lining even be allowed to heal. So don't bother with these supplements here until you're further down the line.
And I'll just share too, I had one client who had really severe hives. And so I just want to say, for anyone who is really struggling with this, where your quality of life has significantly been compromised. So this one client, she had such severe hives and dermatographia everywhere. Just remember one of our calls, and she was like, I feel like I'm almost at the end. I don't know how I can continue like this, because I can't sleep, I can't function, I can't work, I can't do anything. I can't even put on certain clothes, because if the clothes press in the wrong way, I explode with hives, and I'm so itchy that I can't be in my body anymore, and I don't know what to do. So this individual, she was on somewhere between 6 to 8 doses of antihistamines every day,
Oh my
and
God.
on Xolair. I wouldn't have even known. She literally was pulling down her shirt and just showing me how welted up she was. And one of the things we realized, I mean, I really love digging through a case, because it's not just what happened in the last 6 months. It's not what happened even the year before the symptoms started. I want to know what your life looked like when you were born and moving forward, because, look, I'm sure you had the same experience. I went to college. I lived in an old dorm. I'm sure it was moldy. And, those moldy exposures can influence your microbiome. But for her, we did a stool testing and looking over her case. I believe she had H. pylori, which is an infection of the stomach. It's fairly common. I think 50 to 60% of the world's population has H. pylori. And it's very common to have like a silent infection where you don't even have the classic like heartburn symptoms and whatnot. But she had, so this was one of the most interesting things, and I've only seen this twice, but she had a Yersinia infection in her gut, in addition to fungal overgrowth. So she had a candida overgrowth issue, and she had parasites, but she had Yersinia get flagged on the test. And I've only had one other case of an individual with Vicaria who also had Yersinia, and Yersinia can cause a huge amount of histamine to be produced. And so when the doctor treated her for the Yersinia, because I am not at all against medication. I think there's a time and a place for it, and we have to consider the well-being and the suffering that person is. Like, she couldn't work, she couldn't function. What kind of quality of life is that, right? So in that instance, let's utilize conventional medicine as best we can. And I think she got antibiotics for the Yersinia, and she was then treated with antifungals, and she had a huge improvement in things. And then we did some more work with herbs and whatnot to work on some of the other things. And within, let me think, we started in January. By the time she got to June or July of that year, she was off all of her antihistamines, and she was slowly titrating off of Xolair. She's now off Xolair and doesn't have any issues anymore. And she's not like a rogue lone case, because we work with a ton of people who have urticaria, hives, dermatography, etc. And so it's important to consider all of the things around you that could be potentially causing this. And it's weird to have a histamine overload issue with like psoriasis, but it does occasionally happen. You could have a histamine component if you have rosacea. That is possible, but not all rosacea, just like not all eczema is a histamine issue. But I find it fascinating, Dig.
Yeah, and that story you just told is such a great explanation and example to frame why you order that DAO supplement off of Amazon and it doesn't do anything. Not that it's not breaking down the histamine in foods. That is just such a small piece of the bigger picture of the problem. And so understanding what are your underlying causes. And so people listening to this are probably thinking, okay, that clicks. That's why the one supplement I bought didn't work, or that's why I went on the low histamine diet and it's helping, but I'm having all these problems still. And then the other problem with histamine and even yeast and mold, it's tricky to test for these things. We can have some indicators. So this is something I think we need to say clearly. Histamine intolerance isn't usually a root cause. For a lot of people, discovering histamine intolerance feels like a major light bulb moment, and it is. It explains so much of the reactivity, the skin flares, the weird symptoms that didn't make sense before. But even though histamine is part of the problem, it's not the whole picture. It's more of a downstream issue and a symptom of the imbalance. So when we're supporting clients at Nutrition Resolution, we're always asking, what's driving the histamine overload? What's making the body either dump out too much histamine or struggle to clear it? And so we have a few common culprits that we see the most often. One of the most common is methane SIBO. When the gut is slowed down and sluggish, like it often is with methane overgrowth, it becomes like this traffic jam situation. Nothing is moving, and the histamine just sits there building up in the gut. And over time, that slowed transit becomes a vicious cycle because the more histamine builds up, the more inflamed and reactive everything becomes. And then that creates intestinal permeability. So the histamine gets into the bloodstream, causes symptoms around the body, and it just further perpetuates. Another major player is Candida overgrowth. Candida is a fermenter. Think about yeast in beer. It creates a gassy, inflammatory environment that irritates the gut lining and ramps up immune activation. And that constant irritation can trigger more histamine release. And at the same time, slow down your ability to clear it. So you end up with this system that's inflamed, leaky, and just on high alert always. And the byproducts Candida produces, something called acetaldehyde, it does have a burden on your detox and clearance pathways, and that contributes to that kind of overflow feeling of the histamine bucket. And then we also see large intestinal dysbiosis. So even if there's no SIBO or we don't think there's Candida, an imbalance in the lower gut, especially overgrowths of proteobacteria or histamine producing bugs, can create the perfect storm. Yes, histamine intolerance gives us a valuable framework, but we have to keep digging to see what's underneath that. What's the root cause of your histamine intolerance? So when someone says, I react to everything, or even the things that are supposed to help make me feel worse, that's usually a sign that histamine is a big piece of the puzzle, but not the root. How does somebody evaluate this? I think this is shedding light on how important it is to work with a clinician who understands these issues, right? Because the primary doctor doesn't.
No. I think one of the problems is that doctors are looking for infections, and these are not necessarily infections, right? Again, I think it's worthwhile to mention that not all fungal overgrowth is necessarily candida overgrowth, because there's other types of fungal organisms like rhodotorula, geotrichum. So you could have different organisms or even different types of candida species that have overgrown. So I think that's important to consider. I've talked about this on my podcast quite extensively. First of all, if you're getting stool testing through Quest or LabCorp, there's a high likelihood it's going to look fine, and it's not. So you can't necessarily go by that. I hate to break the news to you. Second of all, even if you get like a GI map, GI 360, a GI effects, it's probably going to come back and look fine, and it's not. So you have to know what things to look for. Like I was just saying, how would you know to go all the way back to, say, college or childhood and consider what was going on in your house? What if you lived in a basement apartment for most of your life that was super moldy? Are you telling me that magically, because you're 25 or you're 35 or 48, that because you were there for 15 years, it didn't have an impact on where you are now? Of course it did. Everything affects everything else. And when we're in a moldy, fungally environment, that's going to influence not only our exposure to mycotoxins, which hopefully you've cleared after all that time, hopefully, but it's going to influence your gut microbiome. And then we factor in what your diet looked like, then what happened in college, because I mean, pizza and beer and all sorts of stuff. Oh, and who knows what your diet looked like, in your 20s and 30s and 40s, or even presently. And antibiotic exposure, birth control pill exposure, all sorts of things. Stool testing is not perfect when it comes to both candida and fungal organisms as well as parasites. There's a lot of times it'll show false negatives, or even if it shows up positive and it's not high, it's just like normal, it's within range, you shouldn't see them at all. So realistically, you want to address that, because fungal overgrowth, it originates up in the small intestine. That's where fungal organisms live. We can't test the small intestine, unfortunately, for the fungal population. So if it's grown far enough down to show itself on a stool test, you have a small intestine problem for sure. And you have a large intestine problem as well. And I know somebody will go, but I had an organic acid test run. The problem is that not all fungal organisms that overgrow produce the organic acids that show up on those tests. And I will also say that I realized quite quickly, because I used to run the organic acid panel from Genova really frequently when I first started practicing. So it's for anyone who's had this test runner, if you've seen it as a practitioner, you know that they have this as a little bar that's in quintiles, right? It's broken into 5. And so if you get into the 5th quintile or high, then you have a problem. But I realized if anyone was above the 3rd quintile, so in the 4th and even in the 5th, and it wasn't high, you had a problem. And so you only know that from working with clients and seeing patterns repeatedly and then starting to ask questions. And I find that microscopic stool tests of looking for fungal overgrowth and parasite, and sometimes is not perfect due to biofilm formation within the GI tract, where they kind of build like these force fields. So fungal organisms build force fields, that like kind of hide them. They mask themselves against the wall of the GI tract. And unfortunately, what can also hide behind those biofilms are worms or helminth infections. Bacteria, some, not all, can also produce biofilms. And what will hide behind those biofilms include protozoa. So like it's your first GI map or GI effects or whatever, and you've never done any herbs or anything that could have dissolved the biofilms. It might only show up as, oh, you've got some bacterial problems. The problem is, A, we already know it's bad at picking up fungal and parasites. So we need to go through the case to understand that. We need to look at symptoms. We need to look at your blood labs and understand the context in which these results are framed. And on top of it, as you start working on things, sometimes testing will look worse after a while because now all of a sudden you're like, peeling back the layers and finding more things that you didn't even know were there. And so sometimes I'll be talking to a client and I'm like, I can't tell you that you have a parasite because I have no proof of it, but you have all of these signs. And I feel like we have to put like a question mark next to parasites or fungal organisms and like kind of keep a side eye on it because I have a feeling that's possibly the case. A recent case of mine, this was really fascinating. I get weird cases. I work with a lot of like doctors and surgeons and nurses. And I got this one weird case. This kid ended up with really bad urticaria after getting braces put on. And nobody could figure out why. So I went through the case and I'm like, I think he has like a parasitic issue. I think he has a fungal issue, but nothing showed up on stool testing. I forget which order we did things, so I apologize about that because we've been working together for, I think, about 8 months now, and we've really made a lot of great headway. But it turned out that we did a lot of work and also using some herbs that sometimes can dissolve biofilms in a gentle fashion. And now he had a stool test come back that said that he had, I think, fungal organisms and, oh gosh, was it blasto? No, he had a helminth infection, so worms, but they can only see that they're like in the baby form, so larval nematodes. And the mom was like, what does this mean? Is he work? And I'm like, no, we've been working on the gut. We've been dissolving, unfortunately, biofilms. And actually, you should kind of celebrate and be like, ding, ding, we unlocked a new level. We're going to get rid of this stuff. And hopefully he will get to a point where he does not need to use Benadryl. He does not have a problem going out. He's so much better now because he used to need 2 Benadryl a night. And now he's maybe needs to take a Benadryl. Maybe. And sometimes it will go away on its own. So he's in a way better spot. They actually took the braces off because they weren't sure, was he allergic to the metal? Was he allergic to the cement? And pressure, right? Think about that. All that pressure on the teeth, that in that area caused this huge explosion of hives.
So do you think his oral microbiome was already out of balance? He had something going on in his mouth?
Not necessarily. I think he already had fungal overgrowth. So I kind of look at it similarly like a bucket. The body is amazing. I think we can never state that enough. The human body is absolutely amazing and works in ways that we still to this day don't understand. How I look at things now has really changed over the years. I kind of look at why something happens suddenly is it may have been present. The issues may have been lingering for a really long time. And for whatever reason, your body could handle it. And then there was usually, it's one thing that might seem insignificant to other people. Sometimes it's not. Sometimes it could be a severe infection or a really bad COVID, or you were in a car accident, or you ate some like really bad sushi and got really sick 6 hours later, right? So like we can like pinpoint things and sometimes we can't, but there's something that caused your body to be like, I can't juggle all these plates anymore. I can't keep whatever is happening in check. And sometimes that can be a depletion of nutrient, like so many things. And so in this particular instance, I think the pressure on the teeth, that's my theory. This is my working theory, that the pressure on his teeth caused his body to freak out and could no longer contain what was already it was like teetering on the edge, and it couldn't quite bear it any longer. That extreme pressure of the braces caused everything to go awry, and there he ended up with hives.
Yeah, That's amazing. And, people listening to this, there is no test for histamine intolerance, right? It's looking so much deeper. It can be very complex. You did mention earlier, and let's clarify this because I didn't realize this. As a skin specialist, you said eczema is not histamine. So, how does eczema present differently from the histamine skin reactions?
Eczema can be histamine driven, but most of it's not. The reason I say this is not my idea. I had the pleasure of meeting and then interviewing my colleague, Dr. Sean Quatra. So he was on the Healthy Skin Show, and he ran, I kid you not, the itch lab at Johns Hopkins University. And he's now at the University of Maryland. He moved. So I think he's the director of their dermatology department. I don't quite remember the specifics, but it's something like that. And anyway, he was the one. I had suspected this for a long time because people would go, oh, I have histamine intolerance, I have eczema. And I'm like, do you? Because you don't really check any of the other boxes that would warrant you to be on a low histamine diet. You also don't find that actually it helps anything, or it's like kind of helps, but not really. Like I would imagine it would be a more sizable improvement, but they just don't check those boxes. Histamine intolerance is like way different than just having a skin rash, right? The other conditions I talked about, they're very clear. Those are histamine driven. They take an antihistamine and most likely they're going to feel, depending on how severe it is, some level of relief. But there are a lot of people, if you ask them, if you take Zyrtec, if you take Benadryl, if you take something and you're itchy, does it make any improvement? And they're like, no, it's because you don't have a histamine problem. And an antihistamine is a super, A, they're over the counter. B, most derms will probably suggest it if you're super itchy. If it does not help the itch, it's not that. That's where I started to realize that there was more nuance here. And so I think the mistake that we assume is that itch is a sign of histamine intolerance, and it's not. This was like he's saying all this stuff. I met him at the Eczema Expo that was hosted by the National Eczema Association the first year I went, and he's like, most itch is not histamine driven. There are so many other things that can cause itch. And if you think that this is just all a histamine issue, how many people here have been told to take an antihistamine and you get no relief? And almost, I think 2/3 of the room raised their hands. And he's like, it's because you don't have a histamine problem. So what I have kind of seen is that itchiness is more a sign of, so number one, we want to rule out a skin infection. That's a big thing, especially for eczema. You can have dysbiosis of the skin microbiome. A lot of times we think of Staph aureus, but you can also have other skin infections like a strep infection, a Pseudomonas infection. I had one client who had a Klebsiella infection. Like she was the only one I've ever seen that the culture come back with that. So skin infections can cause itch. Other things that cause itch are the amount of moisture that your skin has. So the drier it is, the more likely you'll be itchy. If you have a thyroid problem, that can cause itch because hypothyroidism, one of the symptoms is itchy, dry skin. So you want to make sure that your thyroid is, at least somewhere close to an optimal range, right? That's important. But also the gut microbiome, I really do truly believe can contribute to this. So one interesting thing that Dr. Quatra shared with me is we have to consider the interconnections within the body. And so I'm sure we have this really interesting nerve called the vagus nerve that connects your brain all the way down throughout your GI tract. It's like literally plugged in all throughout the gut. And so your brain, when you're like, I really feel like this is a thing, or I feel like something bad's going to happen, it's possible you might actually be like, I have a gut feeling. You might actually have a legitimate gut feeling because it is literally your second brain for this reason. And so when we have these imbalances within our GI tract, you have to consider not only are these organisms inflammatory, but their waste products are also inflammatory. So when you have a very unhappy gut, those signals are sensed by the vagus nerve in the GI tract and then sent up to your brain. And what he had shared is he thinks that the brain is misinterpreting the inflammation and pain and discomfort and everything else as itch. Now, I will also say, and this is purely what I've seen in clients, so I can't say that I have any like proof about this, but I find that when people get really itchy at night, so like in the evening when they're about to go to bed or they're in bed and all of a sudden they're starting to get itchy, I would say a couple of things. Number one, you always want to think about your air quality. If you have vents blowing on you, could be mold. So get your vents checked. Could be mold in the AC unit that's in the window. So again, that's one thing to consider. Dust mites or any allergy to the sheets. Now, and to whatever the laundry soap is. Most people have already done some of that. However, fungal organisms and parasites are also more active at night and tend to find that people who have overgrowth of either of these or both of these organisms tend to be itchier at night.
I
And
found that as well.
sometimes liver detox, like we're really not able to provide enough nutrients into our phase 2 liver detox as well. Like liver are sort of like from the Chinese clock, right? The Chinese medicine clock is that liver time is at night. And we're supposed to be like cleaning things up and doing all sorts of, you can't sleep, you feel itchy, you're awful. You know, you're like, oh my gosh, this is awful. I can't do it. We need to take a look at what's happening also with liver detoxification as well, but not phase 1. Phase 1's not the problem. It's phase 2 because that's nutrient driven and that's the one that we can really act the most on. Phase 3 is more, it's excretion, but most of that is looking at gut function. And I would hope by now, like we've already sorted itself out. And I'll also add, if you are constipated or you become constipated, most people will actually notice. This is purely, you know, something that they'll reflect to me. Literally had a client say it this morning. She's started to get constipated and all of a sudden she's super itchy. A lot of times we think these things happen. Oh, but I'm constipated. What does that have to do with me being itchy? Or what does that have to do with my flares? But you're sitting in waste for a longer period of time. You should be having a bowel movement. I would say ideally 2 to 3 times a day, a healthy bowel movement. A lot of people are struggling to just have one. Some people only have one a week, which is to me really shocking. But that's why eczema cannot be considered a histamine intolerance condition, because a lot of times we're blaming the itch on histamine, and that is not accurate.
It's more than that. And I'm so glad you brought up the vagus nerve and the gut brain connection, because I was going to ask about head symptoms, because I see this a lot too with patients, either just the typical brain fog, fatigue, but even weird head symptoms like dizziness or head rushes. They'll explain really alarming things, and so strange that they're often like, the doctor's bewildered. They're like, have you ever heard of this before? That sort of thing comes up a lot with histamine,
Yeah.
doesn't it?
And also too, it's not uncommon to feel anxiety, depression. I mean, hey, these are very hard conditions to live through. I know that we've spent, I think, a lot of the 2010s talking about autoimmune disease, right? Everything was about autoimmune disease and gut problems. And I think while there's still a lot of that there, I think people who don't truly understand what it's like to live with a chronic skin condition, like they're like, oh, but I have Hashimoto's thyroiditis and no one can see it. It's an invisible disease, right? Except these are conditions that a lot of people can see that can produce. It's not even just that you have the fatigue or maybe even some of these brain symptoms you mentioned, burning skin, itchy skin, but for some individuals, they are covered head to toe, or the rashes are in areas they can't cover. They could be on your face, on your neck, or they could be in intimate areas that really impair your ability to have a relationship with somebody or be intimate with someone and make it hard. They really impact your quality of life. And I'm not saying I would rather have one over the other, but I think that I didn't have the appreciation for skin problems until I had eczema so bad that I couldn't even turn the doorknob on my office door, because just the act gripping, to do this, all my skin would crack open and then I'd be left with 1,000 paper cuts. So I didn't truly appreciate the level of suffering that people experience until I was in it. and just want people to know that I don't believe, and everybody has their own beliefs, but I do operate and truly believe that these skin conditions are a mirror of other things happening not only under the surface, but out in their environment. And when we can identify what those things are and work on them, and that may take time. I'll also say this: gut issues, if you just have a gut problem, that's way easier to fix. Now, if you have like inflammatory bowel disease, it's a whole other matter. But I tend to find that people are like, oh, I have chronic diarrhea or chronic constipation. You can address that a lot faster. Skin issues take time. And so if you're looking at somebody who's like, oh, I did this cleanse and in 30 days my skin was healed. Are you using steroid? Like, also there's consequences to using the skin medications, because like
Yeah,
topical
right.
steroids is man-made cortisol. And that you can become actually addicted to. And that can cause a secondary disease called topical steroid withdrawal syndrome. That is a whole other monster that looks like severe eczema, but is not. And it's on top of whatever the original condition you had. There are certain issues with biologic drugs. I think the beauty is to know that you can do both if you need them. You can utilize conventional and the more like integrative stuff together, which is what I love to do, and figure out what the fastest way forward is and what you're comfortable doing. And there's hope. I always operate from that place of, I really truly believe that, ideally I want to see somebody get their life back, because truthfully, nobody wants to think about their skin. Think about it. Even if you have clear skin, like, I don't want to think about like how my skin is aging or the lines on my face. Like, I don't have any eczema or anything. So like, just a regular person doesn't want to think about the texture of their skin and their wrinkles and all that stuff. We don't want to think about it. A person who has rashes doesn't want to think about that either. In fact, they would love a break so that days could go by and they would never have to think or worry about those skin issues, because that would be the freedom that they're looking for, because they would rather focus on their kid's soccer game or their husband's, promotion, or just doing something that they love, and they can't. So I just want everybody to know that there is hope. You don't have to be stuck like this. And that's what I believe, what I've seen to be true. And I just think it bears saying it.
And I totally agree with you. And I think that's such a great note to end on. Can you tell the audience, what work do you do? What does it look like? And how can they find you to get more help with some of these things?
Absolutely. So first of all, I have the Healthy Skin Show, which if you want to dive into all things skin, there's a lot of episodes. We're close to 400 episodes. So there's a lot to learn in this department. So that's available everywhere on YouTube and all the podcast platforms. And then also we have a virtual clinic. So we work with clients and consultant cases all over the world. It's myself and my team of clinical nutritionists, and we support clients on the integrative front. But again, taking into account, like, are the herbs best? Are the supplements best? Or is the diet best? Or is the medication the best? And let's see what we can figure out that's going to be the fastest way forward. So we really try to address the person in front of us, and we do it from a root cause approach. And so we have that. And that is also another option in case somebody's like need help. And then you can find me on Instagram as well. And I also have a really great guide. This is sort of the matrix that I put all my skin clients through. So if they're interested in like, just like, what are my root causes? Because it's not usually one. It's a combination of 3 to 6 issues, but you got to figure out what that is. I have a skin rash root cause finder guide, and you can go through, it's like, there's 16 different categories, and you go through and you check the boxes. There's a little short instructions of like, how do you, did this happen now? Did this happen in the past? And then you score yourself, and it'll help you figure out what that root cause combo is. That helps explain why the stuff you tried that everybody's talking about in a Facebook group that really helped them is not helping you, or it's making you worse. It's because your root causes are different than theirs. So that free guide is also available, which I'm sure you can share in the show notes as well.
Yeah, we absolutely will. That sounds like an amazing resource. We didn't get a chance to touch on this earlier, but I think it's an important note to end on because it really ties everything together. Histamine intolerance might be a clue but it's not a life sentence. Just because you're reacting to foods right now does not mean you'll always have to avoid them. The goal is not to live on five safe foods forever. It's to get your body to a place where it can handle more. So, we don't just help people identify histamine triggers, we work on the root causes that are keeping their systems stuck. We calm inflammation, we restore motility, we support methylation and gut barrier function. We help rebuild microbial diversity and resilience. And when all of that comes together, something really powerful happens. Food tolerance comes back online. We start slow, we reintroduce things methodically, and we use tools like DAO or mast cell stabilizers as needed. But the goal is always to get people off of those tools, not reliant on them, because you can't supplement your way out of a reactive system. You have to actually rebuild it. And I think this is where people start to feel real hope again when they realize they're not stuck in this hyper restrictive phase forever. They can actually work toward enjoying more foods, more flexibility, and more confidence without fear. And that really is the heart of this podcast. It's not just about managing symptoms, it's about understanding what's really going on and giving people a path forward that leads to freedom. Even if histamine is part of your story, you're not broken, and with the right support, your body can become resilient again. Thank you so much for offering such insights and such hope to our audience. This has been an amazing conversation.
Thank you so much for having me.
You're very welcome.